Pessoal, estamos aqui no SBU in situ, em Milão, na EAU 2023, e hoje temos a participação do Dr. Otas Durutovic, que é de Belgrado, na Sérvia. Dr. Otas é especialista em cálculos renais, em litíase, e também ele é membro da comissão de residência, um equivalente à SET, a comissão de ensino e treinamento que a gente tem na SBU. Ele faz parte dessa comissão aqui na EAU. Dr. Otas, thank you very much for being here with us. And I know tomorrow you'll be moderating a section about horseshoe kidneys, stones in horseshoe kidneys. So tell us something about the session, what we will be presenting, and in your opinion, what's the best treatment for it?
Yes. Thank you first, and I'm glad to be again with the Brazilians because during my studies I spent in student exchange 6 weeks in Belo Horizonte, Sampa, Porto Seguro, Arraial da Ajuda and Rio. So I have good memories according Brazil, and I find you very nice people there. So about the tomorrow session, it will be about treatment of large stone in a horseshoe kidney. We all know that it is anomalous kidney, and the specific orientation of the anatomy of the pelvic system also a little bit lower, and also usually is joined with high insertion of the ureter. So it is not so easy to treat stones because if there are residual fragments, they can easily regrow after following treatment. So we are always trying to make these patients 100% stone-free in aim not to facilitate quick recidive and new stone formation. In this way, we are going to discuss about percutaneous nephrolithotomy, about retrogressive approach, but also one interesting presentation will come from the States about robotic approach. I think that especially in terms of anomalous kidneys, the combined laparoscopy or even robotic, what is the best option, robotic approach, can be combined with all these techniques. So I think we always have to adapt to specific scenarios. So there is not one good point of this case presentation tomorrow, but we have to discuss how to approach to every patient specifically, like Palle Oster from Denmark, our famous teacher and urologist, teached us patient-specific approach. Stone specific. So I think Great. That is really important to emphasize that we have to adapt to every individual case.
Great. And we know that EUREP prepares an annual course for the residents. It is usually in Prague, right? And so tell us about the course, how it's done, and if it's open for Brazilians and for South American urologists, if anyone can attend, or if there is anything that we can do to join the societies and maybe bring some Brazilian residents to the EUREP course.
Yes. In recent years, under the umbrella of European Association of Urology, but also European School of Urology, there is a lot of development in terms of teaching young guys, not just residents, but also young academic urologists, and all these groups of young people from their very beginning, when they start teaching to advanced level and even more. So I think EUREP, like you mentioned, is fantastic opportunity happening for 20 years. It is 4 to 5 days in Prague. I saw in the recent past colleagues coming from South America, and I think it's really a fantastic opportunity to come to exchange information, ideas. Also lectures given there are very good. So all residents, or it is organized for residents on the final year of residency or young urologists. Mm-hmm. So it's fantastic opportunity to go to the whole urology because of lectures, and also to train in all procedures like endoscopic stone treatment, laparoscopy, transureteral resection, reconstructive urology. I think from this year it might be also possible to have robotic surgery there. So I think if there is an interest, and if Brazilian Association can support young guys to come to Europe, to Prague, Also, to follow by EAU platform all activities of European School of Urology, because there are plenty of them now. Eurobest in Berlin, Art in Flexible. So many activities are offered to teach people how to treat patients well and upon the latest developments.
Great. Thank you very much, Otas, for being here with us. Obrigado, pessoal. Então a gente ouviu aqui o Dr. Otas falando um pouquinho sobre cálculos renais no rim em ferradura e também explicando um pouquinho como é que funciona esse curso em Praga. Já é um curso bastante tradicional e realmente deve ser de muito interesse para os jovens urologistas e para os urologistas que estão acabando a residência. Vamos ver se a gente consegue fazer algum intercâmbio e trazer urologistas para esse curso. Thank you. Otto já é quase brasileiro já e nos vemos em breve nos próximos vídeos.